In this video, we are going to apply relational practices to a case scenario. In this case, a nurse works in a community mental health clinic and leads therapy sessions regarding mood and anxiety disorders. Bev is a co-facilitator who recently lost her 17-year-old son from a drug overdose. She struggles for years to get her son help for addiction, but her son was diagnosed with opioid use disorder. Life stressors, change, and loneliness were the primary challenges for her son's relapse. Bev was off for 4 months on compassionate leave. When one of the patients talked about her past substance use and trauma in the morning therapy session, Bev became tearful and covered her face in distress. The group had a morning activity to work with, and Bev was quietly asked to step outside the room. Afterward, when the nurse visited her office, the office seemed cluttered with a lot of patient files, Post-its, personal items, and Kleenex. The nurse could smell alcohol on Bev's breath and was concerned that she was under the influence. Bev told the nurse that the job is all she has and will get herself together.
For this scenario, we need to use a relational inquiry approach, which is a highly reasoned, skilled action that involves a relational orientation and inquiring action. A relational orientation is a way of thinking and focusing our attention at the intrapersonal, interpersonal, and contextual levels. An inquiring action approach is a way to get a wider and deeper understanding of the situation. We will begin by looking at the intrapersonal, interpersonal, and contextual factors that are at play for each individual in this scenario. Starting with Bev, if we look at what she might be feeling at an intrapersonal level, we can see that she is grieving and upset due to the loss of her son. When we look at what we may be feeling in the situation, we could be feeling sad for her. We may be unsure on how to approach the topic of her loss, or unsure on how to approach our concerns about her drinking alcohol on the job. From the group's perspective, they have shown that they're feeling concerned for Bev as they do not know what has happened in her personal life. At the interpersonal level, we can see how Bev is communicating with us. She's trying to minimize her feelings and does not want to discuss it. The interaction between her and the group became too much for her when the topic of substance use and trauma was brought up. We are taught as nurses that we need to care for ourselves to be able to care for others. Bev may need more time away from the job because of contextual factors that are at play. Her job entails her to be a support for others, which becomes stressful at times. I feel that if we suspect that she's drinking while on the job, we should confront her in a gentle way and suggest that she may need more time to grieve before returning to work. However, this may be a challenge for her due to economic reasons, so we need to enlist different strategies to appropriately address the situation. For example, we can use the HP lens. The HP lens is a tool to help us focus on an individual's lived experience and how each of those experiences are meaningful to them and how they are being interpreted. Once again, we can use the intrapersonal, interpersonal, and contextual factors within the HP lens to get a deeper understanding of the situation. When we look at Bev's situation from an intrapersonal level, we need to ask questions like, how is she experiencing this situation? What is most meaningful to her? We can tell Bev is struggling to cope with the loss of her son and may be feeling guilty that she was not there at the time of the suicide. At the interpersonal level, we can look at how her response to her loss is being interpreted and how it is shaping other people's responses. Her reaction to the person talking about substance use may cause the individual to not want to speak about it in fear of causing another reaction like that. We also look at the contextual level, where we look at an individual's everyday world. For Bev, she's living with her loss every day, and the grief that she feels does not go away. This will shape her everyday life and will change her interpretations, experience, and concerns on a daily basis. When we use the HP lens, we need to remember that everyone will experience the same situation differently, and we need to move beyond our reference points to widen our understanding. Applying the HP lens to Bev's situation allows us to look at what is meaningful to her and how she is interpreting situations around her. By better understanding her situation, we can come up with a better plan to approach the drinking situation.
The critical lens investigates how power dynamics create situations that influence how people behave and respond to certain situations, and how nurses implement their practice in each situation when caring for their clients. In this scenario, many power dynamics stemming from social, economic, and historical factors can be identified using the critical lens that are otherwise implicit. Bev is facing difficulty coping with the recent loss of her 17-year-old son. With this loss, different aspects of Bev's life come into the spotlight when looked through the critical lens. These aspects will highlight the intrapersonal, interpersonal, and contextual elements involved in relational inquiry. Looking from a critical feminist perspective, Bev's response to her son's loss can be looked through the eyes of a mother who has failed to nurture or guide him properly. Bev may be suffering from guilt of not being able to help her son overcome his habit of misusing opioid drugs and his eventual death resulting from his drug overdosing. Her sense of guilt and sorrow is evident when she breaks down in tears while one of her group therapy clients was narrating their story of substance use and trauma, and also when she was found to be under the influence of alcohol as a possible way to cope with this. The inability to nurture her son away from opioid use may have served as a driving force for Bev to continue attending to help people in similar situations as her son. This way, Bev may feel less guilty of not being able to live up to society's standard of a good, caring mother by continuing to enact her supportive and nurturing power as a nurse for the clients she serves in her community mental health clinic. Toward the end of the scene, or story, Bev requests her colleague to not disclose her breaking down in front of her group therapy client during a session and that she will get her act together to ensure that she does not lose her current and only job that she has. Taking 4 months of compassionate leave may not have been enough for Bev to heal from the recent loss of her son, as evidenced by her failure to maintain emotional composure when one of her clients was relating their story about substance use and trauma. It may be inferred that Bev is either a single mother responsible for taking charge of her sons and her own living, or that Bev is a breadwinning member of the family with her spouse or partner making minor or no financial contribution. Whatever the case, Bev may have been obliged to return to work earlier than was required for her to heal from her son's loss and be able to fully grieve owing to financial constraints. Even though it is clear from Bev's emotional instability and indulging in drinking to cope with this that she's not fit to work. Bev's desperate effort to cling on to her job may be influenced by the need to hold on to her values of compassion and altruism that she may have adopted from her job, and which seems to contribute to her current self-identity. From the story, we can infer that Bev living alone at home in her current psychosocial state may not be conducive to her functioning properly in daily life, and as such, she looks to her job to live meaningfully. Her values may serve as a way for her to find a coping mechanism to salvage and preserve the values she stands for. Unfortunately, she does not seem to have healed fully from her sense of guilt for her son's loss and from grieving, and this effort to be at work is thus not feasible and helpful to her or the clients she's trying to serve in her community. Based on the thoughts that the critical lens had to offer, Bev may need some more time to stay away from her profession, needs consolation from a trusted friend, and find alternative means of helping her find meaningful things to do in her daily life that will help her recover from her recent trauma. She may benefit from the knowledge that a lot of the circumstances surrounding her recent loss, stress, and trauma were beyond her control, and that she should not shoulder full responsibility for the death of her son. There is an obligation to address Bev's potential drinking behavior and educate her of the need to seek help or therapy to help prevent another such occurrence. Opportunity should be provided to Bev to explain and relate what she's going through and what is going on in her life that have led to her current state, and explore what options she may have in her journey of recovery and healing before resuming work.
It can be difficult to deal with the stigma around substance abuse, especially in the workplace. In this scenario, Bev is clearly impaired as is outlined in the BCCNM's resource for signs and symptoms of possible substance use, by the smell of alcohol on her breath, sudden changes in her mood, and inability to fulfill her duties. Intrapersonally, Bev is likely concerned that if colleagues and clients knew about her own problematic substance use, she would be stigmatized and not be taken seriously in the role of substance use guidance counselor. She likely knows that she needs and has a duty to report her situation and seek help, but is afraid of the consequences of people finding out. According to Pavinin and Bade, when women seek help for problematic substance use and addiction, barriers are erected that victimize and disempower them. This quote sums up the fears that Bev may be faced with. The nurse who discovered Bev's problematic substance use also is at risk of stigmatizing Bev. They will be concerned that Bev cannot perform her work obligations safely and may have negative feelings towards her for putting them in the difficult situation of having to report Bev to a supervisor. They could be concerned about the stigma from other associates due to speaking out against a trusted colleague or not fulfilling their obligatory policy of reporting their colleague in this situation, or for receiving a label like narc or rat. Using a critical lens reveals an interpersonal power imbalance between the two nurses in this situation, with one nurse having power over Bev by having the choice to report Bev her misconduct. These two people are described as trusted friends with a strong 4-year relationship. Bev may see the other nurse as untrustworthy and no longer have a trusting relationship with her if she decides to report Bev. Bev may be seen as problematic by the other nurse by asking them to violate BCCNM and workplace policy. The social context around substance use in Canada negatively affects women by impeding their ability to adapt coping strategies to reduce the harm to themselves and their families from substance use problems. Bev is affected by the contextual stigma towards people who use substances, especially as a person that may be perceived as an example to other people with substance abuse issues within her guidance counseling groups.
The ways of knowing. Empirical way of knowing stems from the idea that the assumptions and facts of the physical and observable world can be accessed to organize one's practice and draw conclusions of what the person observes in a systematic approach, developing abstract explanations. Several cues are displayed from Bev after she has returned from her leave, detecting emotional distress, alcohol noted on her breath, and her desk is cluttered, which appears to be unusual for her. This empirical method shows that her time of leave was ineffective. Different strategies may be need to utilize to cope with the emotional distress Bev is feeling, so speaking with a doctor and advocating for proper medication could be an effective strategy. Aesthetics way of knowing focuses less on what is physically observable and instead focuses on the different meanings of the situation at hand. This helps people to appreciate the deeper meaning from a personal standpoint, allowing them to see the whole picture and what influences it. Looking at how you interpret the situation and its different meanings, you see Bev values her job, and despite not being fully well, regardless of her emotional state, she values working more and tries to continue on with her work life. While the patient speaks on the experience they had previously with drug abuse and trauma, this taps into Bev's past experiences with her son, making it difficult for her to complete her work. You value your work and the patients that you care for, which appears to conflict with your value of your coworker, who, being in their given state, hinders the patient's ongoing care. To help your coworker, you can redirect their task to something else so that she does not have to be exposed to stressful reminders while she continues to recover. The ethical ways of knowing takes into account societal norms of what is the right course of action that one should be following. This guides and directs nursing practice based on obligations and resolving conflicts of different values, which can lead to resolutions that can sometimes be unsatisfactory. Within this moment, we come to a dilemma where we are not able to allow Bev to continue on with their work in such an intoxicated state. But this is your friend, who in their previous work could be trusted, which shows the ethical dilemma between supporting your friend and following your job requirements to report this. Bev may need more time to cope with the loss of her son, so instead there may be the ability to work from home so that she does not hinder the care of patients. Emancipatory, or socio-political, ways of knowing draws upon the social structure that influences decisions that may affect people from the individual or the entire group, and is used to generate social reforms that develop safer outcomes for those vulnerable to the current system. Compassionate leave is the same across the board for anybody that uses it, which can be unfair to those who require more resources and coping strategies, but are left in the dark and are required to keep working regardless of what is affecting them in their life. We can see as a worker, Bev's emotional health is not being considered, and instead she is being obligated to complete her job. Additionally, ideologies that are at play could be that working to be productive may be weighing heavily on Bev, which may force her to feel obligated to work. Both you and Bev together can talk with their supervisor and advocate for additional resources to be utilized that could support Bev, such as a support group or being allowed to work from home where she may feel more comfortable.
As Bev's son died of an opiate overdose, Bev is tearful. Bev's office is cluttered, and the nurse could smell alcohol on Bev's breath. Implicit bias could play a huge role in how the nurse perceives Bev's current situation. Implicit bias is attitudes and feelings of which we are unaware. If nurses seek context based on implicit bias rather than relationally, it could negatively impact how she sees Bev's overall situation. However, the relational inquiry is oriented towards context complexities and producing circumstances that foster the well-being of people and culture. The nurse could control her thoughts and emotions during interaction with Bev and utilize the perspective taking to understand what Bev is going through. These strategies would help in partnership building and stereotype replacement to build that effort.
The situation of caring for a patient or even a colleague through an ethical lens can submit a nurse to moral distress. Deschenes and Kunk, 2019. Even if care is not being directly applied within the situation, being able to make judgment calls within an ethical lens and approach can also submit a nurse to moral distress. Deschenes and Kunk, 2019. Within this scenario, we are presented to be a nurse whose colleague has lost a son due to opioid use and addictions, and in turn has overdosed. This colleague has faced a breakdown at work, and after a short discussion has presented to have been drinking and may be under the influence of alcohol. As a nurse, we follow a code of ethics. These codes of ethics for nurses are developed to provide guidance for ethical situations and to inform nurses of the moral responsibilities in which they are bound. Deschenes and Kunk, 2019, page 767. But what is to be done as a nurse when a colleague is under the influence of alcohol while providing care? When this colleague has suffered a grievous loss and has pleaded to not have this incident shared or made public? As a nurse, are you not obligated to report them? Or are you obligated to help and support them through these troubled times? But what is support in this case? What ethical lens can be applied? Relational ethics is an action ethic that recognizes the significance of close-up ethical moments and the relationships that exist in these moments. Deschenes and Kunk, 2019, page 768. The first component to using a relational ethics lens are the 5 W's. The 5 W's are used to help recognize the situation we are in and have been presented with, to help ground us. Dwan and Varco, 2021. The first W is what? Relating to Bev, seeing the pain and anguish, relating to her current situation and struggles. Dwan and Varco, 2021. The second W is who? Bev. The third W is why. Bev has just lost her son due to an overdose and has recently returned to work. She just suffered a breakdown in a group session you are holding and after proceeding to her office have smelt alcohol on her breath. Dwan and Varco, 2021. The fourth W is when. Now is the time to initiate an ethical approach to Bev, to try and be present with her. Dwan and Varco, 2021. The fifth W is where. The environment is her office, outside of a public group session for patients. Dwan and Varco, 2021. The second component to use in a relational ethic lens are the 5 C's. The 5 C's are the application of an ethical lens. The first C is compassion. To be present with Bev. To endure the pain with Bev, whether in the form of words, listening, or just sitting with her. Dwan and Varco, 2021. The second C is being curious. Being interested in Bev's situation, what she has to say, how she is feeling. Being inquisitive into those emotions, asking her how she is doing, coping, and if she has resorted to other methods of coping, such as drinking. Being uncertain of the outcomes to come. Bev may recover, she may not. She may delve into alcoholism. This could be the first and last time she drinks on the job. To know and to not know. To recognize that in this situation, would you be any different? Can you judge her for her actions, for her grief, and her breakdown? Dwan and Varco, 2021. The third C is committed. To be committed to Bev. To try and be there for her in every form that is possible. To commit yourself to helping her, to help her through these troubled times, in the hopes that eventually she will let you in, to confide in you, or further the relationship between you and her. Dwan and Varco, 2021. The 4th C is competence. To apply a non-maleficence approach to Bev. Your ability to help her, without harming her further. Then to evaluate your nursing knowledge and skills and how to apply them and discerning what is appropriate within the situation. Dwan and Varco, 2021. The fifth C is corresponding. To slow down and match Bev's energy. To be present with her in ways that is equal to act in correspondence with Bev. To support her, to be present with her, and not rushed because you are currently holding a session just outside her office. Dwan and Varco, 2021.
In Webb's situation, relating to emotions could guide the nurse to pay attention and address the event relationally and orient to the well-being of all involved. A nurse could orient her work towards capacity building. To elaborate, we tend to focus on what is not going well during an encounter with difficult situation. Looking for the capacities in different scenarios can help the nurse to work collaboratively with BEP to address the present moment. The nurse could work across all three levels of inquiry, intrapersonal, interpersonal, and contextual, to promote the well-being of BEB